talk about the use of artificial intelligence in particular, very briefly, on the current situation against COVID-19. And I will start from the question of what do we want to achieve? What is the reason why we want to deploy this technology? And we can come back to this concept of flattening the curve. It has become a sort of universal motto in the responses to the current pandemic. And here, if we think about what is the concept of flattening the curve, is to reduce the spread of the pandemic so as not overload the medical capacity. So being able to treat people who get infected, and this is a way for us to remain under the constraints of availability on serviceability of the medical system, have a workable pipeline of people who need attention and people who can provide it, while at the same time we buy time for getting new treatments and getting a vaccine. So all this technology is going in these lines, and this underlines one concept, and is that the development of technology and the success of this technology depends on the way it is applied. In order to be able to flatten the curve, this technology should help making better decisions, having all the resources available in order to contain the spread, in order to provide services for people who get infected. And this is where the technological solutions have been oriented to. And as Clarissa mentioned, one of these first applications is to better understand the characteristics of the coronavirus. So we are, for the first time in history, probably living this pandemic in real time in the way we analyze the virus, in the way we analyze the spread. So the genomic came very quickly. We also know that this is a virus that can mutate very easily. So there's a need to rapid analysis of the structure of the virus as a way to signal potential treatments and potential vaccines. Having said that, the technology and artificial intelligence has played a huge role there on speeding up the initial phases of identifying candidates for these vaccines and treatments. Nonetheless, we always have to wait till clinical trials are performed in order to assess the efficacy of these potential treatments. And this is something where there is not much that the technology can do to speed up this assessment. So there is a technological limit on that. And this brings back again this the idea that the success of technology doesn't lie in the technology itself, but the way it is used and the way it is interfaced with the information we get from the human factors. Once we have this understanding as one of the main axes of study, another line of applications of artificial intelligence is the monitoring the spread of the pandemic, initially as an outbreak. There were early warnings of that fast spread, and this was information that was recovered from news, recovered from sales of airline tickets, from official reports in the medical systems, as well as informal reports through social media. So there were many efforts that tap in natural language processing, in data mining, to find patterns of this spread. And this allow the community to identify early warnings about what's happening. And this is a very important aspect, because this can improve the readiness of the medical system or the political system to fastly react to the potential setting of the pandemic. Nonetheless, we have to be careful on the potential success of and accuracy of these systems. There are precedents of one particular case. 10 years ago, there was a system developed for this very purpose, to predict flu outbreaks. It was called Google Flu Trends. There was also Google Dengue Trends, that was trying to predict outbreaks based on searching behaviors. And at the very beginning was extremely successful, but then performance started to decrease, and it was not reliable enough, at least didn't fulfill the expectations. And there were many factors that that influenced that. One of them that is that people have different patterns of behaviors depending on whether it's a seasonal flu or something out of season. There are influence of the news and, for instance, about upcoming outbreaks that may bias this, the performance of these systems. And there is also the fact that these models were being updated through time, and there are not necessarily a good record of the lessons learned from these previous efforts, so that we building more and more reliable systems. So these are some of the things that need to be further developed in order of monitoring. And also we have the aspect of tracing contacts that we have right now. And I'm not going to enter into many details there. I think we'll come back later to that, and how can we monitor contacts between people, and this can help identify whether the preventive measures are put in place are being respected, but also may open the way for privacy breaches. We have also this idea of bringing novel ways for diagnosis. Was already mentioned the use of medical imaging and CT scanning. There are people developing techniques that are, for instance, based on sound, trying to see if infection can be decoded or inferred from the sound of coughing. And there are several groups working on this. These are concepts that are still require validation. And in the same way as we mentioned for vaccines, the overall accuracy and performance of these systems will only be known after it has been extensively tested in a large number of population. And this brings something that maybe particularly interesting here is the fact that the spread of the coronavirus has first touched the northern hemisphere and hasn't had yet that the same level of incidence in the southern hemisphere. That means that the models that are done right now for diagnosis and for monitoring and other applications may have an intrinsic bias depending on the people who have been infected so far and how these systems are validated. And this is something that needs to be taken into account when new solutions based on data science and artificial intelligence are put in place. And last but not least, we have this social interaction. There is one part that is really linked to the pandemic, which is the spread of information, the spread of misinformation, and the fact that by the very nature of the algorithms used in social media, these have an effect that tends to amplify information that has a shock value, and it often may be fabricated or spread information that is misleading. And some other applications and consequences that are not directly related to the pandemic, but to the situation that it generates, are the fact that we moved to movement restrictions, we moved to working remotely, to use extensively systems like this to communicate and to share information. And this creates a wealth of data that is additional to what we usually do. There are many, many services, many types of work that moved digitally right now. Some of them, were forced to update. If I think in the case of e-health, there were many services that were reluctant to adopt digital measures or digital records, and now there is more openness towards doing it. But if we do that without paying sufficient attention, this can open the way to provide data that can be used for different purposes that it was intended to or agreed to by the end users. So these are some of the consequences that the use of these technologies may have. And here we start entering a little bit of how can we contribute, but at the same time can create opportunities for misuse or abuse of artificial intelligence techniques. And all this development of technology is done in a particular context. It's a context where there is a sense of urgency. There is this idea of act rapidly, develop solutions at a fast pace, because we want to actually flatten this curve and contain the pandemic. But of course, this creates a tension with the proper validation of the solutions that we develop and the unintended consequences that they may bring. There is also a geopolitical context that needs to be taken into account when we talk about the use of technology. So who will be providing the technology, who's providing the data that allows to develop this technology. And this is done in a context where there are not well-defined governance framework of what can be done with the data, what cannot be done with the data, what can be shared and what cannot. And I think this is something that needs to be considered. So how can we develop this kind of techniques is, of course, a huge question that many people are posing themselves. And as Clarissa mentioned, one cue is the involvement of different stakeholders. And I will add other ideas that have to be taken into account, like the concept of transparency, to be more clear, not only of what do we do with the information that we have and the data that we have, but also on the extent of which these systems have been tested, and the constant need to continue assessing the risk and benefits of these new technologies and be agile enough to adapt in case we see that the systems are not behaving in the way we expect or are not fulfilling its initial purpose.